When we think of access in healthcare, we often default to systems like scheduling, workflows, technology, and they're all designed to remove friction so patients have access to care. But truly, access is much more than that.
Welcome back, everyone. Again, I'm Ebony Langston, founder of the Patient Experience Strategist, and today's guest is Loren Jacome, the Senior Director from the Office of Patient Experience at Essen Healthcare. Before we dig into our conversation, let's start and let the audience know just a little bit about who you are, how you got here, and what you and the team at Essen are working on.
Perfect. Thank you so much, Ebony, for having me join this podcast. I'm really excited to participate. A little bit about myself. I am a Washington Heights, New York City native, so growing up in a very diverse neighborhood. I got into healthcare by happenstance. Someone asked me if I knew how to speak another language, and I said yes. And from there, sort of my career took off as a certified medical interpreter. I did that for years. I traveled all through New York City. I visited many hospitals, many of the hospitals that are very renowned nowadays. And then from there, I was very fortunate to have a highlight in my career, which was working with international patients. And the stakes there were very high. Precision, service excellence were paramount because we had patients traveling 23 hours from Australia, from China, from many different locations. So delivering an excellent patient experience was important. And now I am in the patient experience field. I started that off at Optum United Health Group, and today I am at Essen Healthcare and also the other affiliate divisions within the organization.
Awesome. When we met a few weeks ago at the IPX conference, one of the reasons I was excited to talk to you, you opened your talk with a story about your partner and what it was that he needed to feel seen at the doctor's office and understood. How do you think about community fit as a part of what access actually means, and what are most systems getting wrong about it?
So I'm really glad we're talking about this because in access, when we think of access in healthcare, we often default to systems like scheduling, workflows, technology, and they're all designed to remove friction so patients have access to care. But truly, access is much more than that. And I had a moment during a diversity, equity, and inclusion training at New York Presbyterian that really helped me shift my thinking about what access really means. And what I took away is this, that access actually begins way before the patient even makes a choice to pick up the phone or engage on a website or enter a portal. It starts the moment the patient feels represented and engage with the healthcare system, when they see themselves as part of the environment for the healthcare system that they're considering to engage with. So access really isn't just about proximity or availability. Truly, it's about relatability and representation. So whether someone feels recognized or valued or understood, that's what I would call a community fit.
Yeah, I think that's so true. It's trust and access means different things for different communities. It's not just about having the schedule. It's can I actually talk to someone who understands what it is that I need? So I really appreciate that perspective. And kind of playing on that, so much of trust gets built or broken in the patient experience around the actual care, the clinical care that's delivered. And I understand Essen's model kind of runs that wraparound. Where do you see the biggest gaps, and what's the single most consequential piece of the experience outside of the exam room that providers are challenged with?
Yes. So I agree. Trust is not just built within the exam room. It's also built in every touch point throughout the journey, especially post-visit as the patient moves through it. So one of the biggest gaps in healthcare is in the smooth handoff of information between those touch points. So healthcare is still highly fragmented, and too often each person sees themselves as the end of the line as opposed to part of a continuous experience for the patient. So one of the things that I would say is the most consequential issue is then the incomplete handoff of information between those touch points. When a team internally doesn't coordinate well the exchange of information, patients feel it externally. So they don't receive the call they were expecting, or they don't care, or we don't carry complete information forward to each other, and the patient can see that. And that's where trust starts to erode. Earlier in my career, I spent years honing in on what does good coordination look like? What does that good information exchange look like? And although coordination is an undervalued role, it's actually really critical, because when care coordination is done really well, it has the power to deliver a seamless care experience for patients, which in turn builds trust and has them travel 23 hours in an airplane to get medical care. At Essen, we continue to grow and expand. So being able to pass that information or coordinate information really well has become more critical. So we've anchored ourselves in this value that continuity is everyone's responsibility. There's no such thing as my job is done here. So we ask both clinicians and frontline team members to think critically and with curiosity, what is going to happen next with the patient once my interaction with them ends? And we talk a lot about passing the baton. The way you hand information over has to be precise, complete, and thoughtful. Basically, the next person's ability to succeed is directly tied to how well you set them up. Your job isn't done until the next person can do theirs really well.
Within our organization, we talk about the 5 pillars of trust, continuity certainly being one of the biggest ones to drive satisfaction, experience, and revenue, right? Because when people feel known, seen, understood, they come back. And so I love that you guys are instilling that in your team to kind of think about what's next and what the patient is experiencing throughout their entire journey. So I kind of want to get back to access. So we talked about access, of course, is not just being able to get in for an appointment, but that is important. And, being able to get in is still one of the biggest areas of frustration. Being able or having to wait several months for an appointment certainly can look like a failure. You kind of shared a story about turning that into a recovery trust moment, kind of that service recovery as a fair trade. Can you talk a little bit more about what that looks like when it's done right and how you turn recovery into a trust building moment?
Absolutely. So it's important to first define what it actually means to do recovery right? And there's thankfully a lot of peer-reviewed literature on this, much of it coming from outside of healthcare, but very relevant to our space. So one of the frameworks I think about is organizational justice-based theory. It's coined in many literature. One of them is Shapiro et al. 2006. And what it says is that it reframes recovery not just as a process, so procedural, but there also has to be an exchange that has a distributive and an interactional component. So interactional is what you say, the tone. Procedural is what your process is. And then the distributive pillar is talking about what is the fair exchange that's happening in this interaction. So the 3 of them influence how people experience recovery as fairness during breakdowns. That's what's ultimately building trust, and understanding that whatever happened, the recovery must feel like a fair exchange for the time, effort, and emotional investment that the patients are making. In that moment, patients are asking themselves, is what you're offering me in return proportionate to what I've invested or lost? And too often, as we mentioned, what we offer falls very short. We default to what's operationally convenient for us. So we'll see you in 3 months instead of what actually feels fair to the patient, and trust starts to build down. So at Essen, we've worked to reframe that moment. We ask ourselves, what could we do in this exact moment, and what would a fair outcome look like here? Not what's easiest for us, but what restores the balance of the exchange. Because the reality is, whether it was our error or a misunderstanding on part of the patient in front of us, they are in a very vulnerable position. And vulnerable looks different in many ways.
So final question, because I can't let people go without talking about AI, the topic of the century, right?
Yes.
And I know as most health systems are moving fast and investing in, I have seen some stories about investment on the clinical side with open MRI and some acquisitions. But I also hear a lot of talk of just being kind of in pilot fatigue with AI and having a lot of pressure for it to, actually deliver some sort of ROI. What is your perspective on where you think AI actually belongs in the patient experience, and how do you know it's earning its keep?
Sure. So where AI belongs in patient experience has to be very intentional. And where I think it belongs is where it can scale what we already know works really well. So instead of just starting with the technology, we take the best practices that are already in place, which have been tested and proven by clinical, operational leaders, but also validated by our patients. And then we look at where can AI help us apply those practices more broadly, consistently, and at scale. So at Essen, AI is very much integral as it builds on and refines what we've already done and know to do well. Now, in terms of how we know it's earning its keep, right, and it's not just a pressure to invest or embed AI, is we measure it through performance. So one example is our online reputation. Over the last 12 months, we've increased our review volume by 445%. And at the same time, improved our average ratings across platforms from anywhere low to mid 3 range out of 5 stars to well above 4. So what it's two things is that we are reaching more patients through the help of AI, and the experience we're delivering is resonating consistently. So one example, right, is we respond to every review. It gets a unique response. We've developed clear standards for what those should look like. No two responses are alike. But within our AI platform, it allows us to scale the work. Yet every response is still refined to make sure that it meets our expectations in terms of tone, structure, empathy, direction, and accountability. And there's other examples like that I could share, where AI adoption is very intentional, and that's how we escape the AI fatigue.
Yeah. Well, congratulations on those results. And what I'm hearing is you guys had a clear strategy. You started with a clear strategy and knew what the outcomes you were going after was versus chasing a shiny, cool new tool and seeing how it impacted.
Yeah,
Definitely
absolutely.
starting with strategy is the key. Well, Loren, thank you so much. If you're listening to this and it ended, I invite you to go follow Loren on LinkedIn. And I'm Ebony Langston, and I'll see you next time.
Thank you.
Well, thank you.